And we want to turn now to what the American Medical Association is calling an urgent public health crisis. And believe it or not, those supply chain issues are to blame. Dozens of life-saving drugs are in short supply, forcing doctors to use less effective medications. We get more on this from CBS's Mark Strassmann.
At the University of Virginia Medical Center, 24/7, technicians fill single-dose drug orders for nearly 700 patients. Pharmacist Brian Spolhoff's job? Find drugs in short supply somehow.
By the time I come in, we have a new list of new medications that are short. This is tocilizumab.
Take this targeted anti-inflammatory, tocilizumab, needed by both chemo and COVID patients, and there's not enough for all of them.
If you run out of this, patients could die.
Yeah, if we run out of this, patients aren't able to get some really important chemotherapy, and without that chemotherapy, they could die.
Spolhoff's constantly looking for around 90 critical drugs.
Doctors actually have to ration care based on what drug supply is available.
Yes, absolutely.
The FDA currently lists 109 drugs in such short supply nationally. The American Medical Association calls the shortage an urgent public health crisis that threatens patient care and safety. 3 of the top 5 shortages, drugs used for chemotherapy, heart conditions, and antibiotics. With tocilizumab, UVA's hospital made a tough choice. Save it for chemo patients. Deny it to COVID patients.
And I think a really important thing is just kind of knowing the course of the disease.
The ones treated by Dr. Patrick Jackson.
It does mean that some patients are getting the drug that I would not ideally want to give them.
Potentially worse outcomes?
Potentially.
Spolhoff knows what you're probably thinking.
For a lot of patients, it will feel very unfair.
But is there a solution?
If I had a solution, we wouldn't be in this situation.
And Mark Strassmann joins us now from Charlottesville, Virginia. Mark, is part of the problem that we're not making many drugs here in America anymore?
No question, Norah. In fact, America makes less than a third of the prescription drugs that Americans need. But there are other forces contributing to this drug supply chain breakdown, including trade restrictions, the pandemic, and various complicated market dynamics. The bottom line is this: hospitals do what they can with what they've got. Worst case, they have to deny patients the best medicine for them. Norah?
Wow. Such an important story, Mark Strassmann. Thank you.